Um, Shortly after I started here in 2007, our current practice management software was being discontinued, and so we needed to look at replacing that. And we knew that while we went about the process of replacing the practice management software, we should also look at implementing the clinical modules for that. So we went through a vendor selection process in 2007 and selected a vendor for both the financial product as well as the clinical product. We wanted to do it in a phased approach, that we did our financial side first and then put in our clinical piece after that. And we've kind of pushed back that clinical piece for financial reasons and things like that. But we've known ever since then that we really wanted to move from a paper-based system to an electronic system for numerous reasons. Biggest one being patient safety and patient care. We look at a couple of main points that we're looking at. Efficiencies is the biggest thing. I think we're really looking at ways of automating processes and making the whole patient in the door to discharge being a lot more efficient for our staff as well as for the patients. We also really look at it being a patient care type of area. As a critical access hospital, we're located an hour away from the nearest big hospital, and we cannot provide a lot of the services that the bigger facilities can. We're kind of a stabilizing ship type of facility. Well, with an electronic record, we really look at the ability to share that information from the time the patient presents to our doors to the bigger systems in a timely fashion, in a accurate fashion, so that when they arrive by ambulance or by air or whatever to the bigger facilities, they're already prepared with all of the information that we've been presented here, and we can kind of share that information to really help the patient in that situation. I've been keeping up with a lot of the things that have been going on with the High-Tech Act and those things. We really were looking heavily at the meaningful use dollars that were out there through the AARRA, and so we had heard of regional extension centers through all of that. Didn't specifically know about HealthPOINT, but we knew about regional extension centers, and then HealthPOINT actually was the ones that came out to us and kind of informed us about what HealthPOINT does. And we knew immediately as a small facility that it would be something of value to us, because we don't have the resources that larger facilities do, in terms of being able to bring out outside help to help us go through the process of implementing electronic records. So we were excited at the possibility of having some federally funded programs that would help us to see some of the benefits that other facilities do. I really look at HealthPOINT being able to bring an outside perspective to us as a facility who have little to no expertise in what it means to implement an electronic record. We look at somebody else who's been able to see what works, what doesn't work, what obstacles need to be addressed, what are some of those things that we need to be looking at that we wouldn't otherwise know until we were in the middle of it, and we would not be able to have as smooth of a transition as we go through this process without bringing in an outside source who's been through that. I think the biggest thing that I'm looking forward to is really kind of being more towards the forefront of technology. And for so long, as a rural facility and a small facility, we're kind of forced into the antiquated processes, the papers and the banker's boxes of charts and things like that, and being able to bring our small rural facility into the technological era and really being able to move forward with electronic records, for our patients and for our staff. I think it's really kind of it will be a crowning achievement to be able to show our community, hey, we are meaningful users of an electronic health record, where more than likely nobody else around us is. It's coming. I mean, I think everybody knows that use of electronic health records is something that there's no getting around in the future, and I think that the government has shown us that they have made it a top priority of theirs, in terms of their incentive programs and their penalties in future years, that everybody's going to have to do it at some point. And if we know that to be the case, we might as well start out ahead of time, so that we can get those kinks worked out and kind of get things resolved as we go, so that we're not coming up against the deadline saying, hey, next year if we're not users, we're going to be penalized in our payments, and then trying to rush through that process of getting things working. It's the way of the future. I mean, that's just the way that things are going to be going in the not too distant future.